was dealing with an extreme asymmetrical breast condition where my right breast was a double D and my left breast was a C. It makes you feel disfigured. It makes you feel not whole, not complete as a person, as a woman. In the form of intimacy, it's definitely a challenge because you don't want your partner to be shocked, when you're having an intimate moment. So you want to explain about what's going on before you have an intimate moment, with your partner. I researched, of course, on the internet, researched breast asymmetry. I consulted with my primary doctor, my OBGYN, asked for referrals, talked to other women that had breast augmentation. I also talked to nurses in hospitals, researched on the internet. So I'm somebody that definitely likes to research what I'm going to do to my body. I went from the most expensive doctor, well-known, and to anyone that I felt might be able to perform the surgery the way that I wanted. The way that I met Dr. Rademaker was I had seen him on television for an accent machine. It's a machine that helps to reduce cellulite. So I came into the office and met with Dawn, and that's how I started coming to Rejuva, was through the accent machine. And ironically, when I met Dawn, I also had set up 2 other consults with some other board-certified plastic surgeons here in Tampa. And she said to me, Dr. Rademaker is a plastic surgeon. Have you consulted with him? I said, no, I haven't. His name wasn't on one of the lists that I received from some doctors and friends. And she said, well, why don't you consult with him? He's an excellent plastic surgeon, and you're at nothing to, you have nothing to lose. Just consult with him and see what you think. And I said, why not? I waited this long, 2 years of research and meeting with other doctors. Sure, absolutely. So I set up an appointment. It was actually a month before I got an appointment for a consultation, and I was kind of eager. This was the year that I was going to do it, because I promised myself before I turned 40 I was going to complete it, and I didn't because of an illness. So I set up the consultation, and I had another consultation just 2 weeks before his, and I was this close to picking that doctor because she was highly recommended by the staff at the Women's Hospital. I said, no, I have one more consult, doctor, and I'll let you know. I'll make my decision. It's not something that I like to go home and digest everything and then make my decision, not based on the emotion or how I feel at that time. I like to go home and analyze everything. My goal was to do this once and get it over with, because I have 3 children and I don't want to risk going under anesthesia, because I have a future with my children. So absolutely, it was, hopefully for me, I wanted it to be a one-time shot. And I just didn't get the right feeling from all of the doctors. They weren't completely honest. They didn't know that I had researched it so far and so in depth. So I didn't find them completely honest. And some doctors wanted what they perceived the way the outcome should be, not what I perceived. How long did it take me to decide that I wanted Dr. Rademaker? 24 hours. I had a meetings of the minds instantly. After surgery, when I went home, I expected there to be some pain, but not, this type of surgery, there may not be extreme pain. And honestly, I didn't have any pain. The only reason I took pain medication is because they instructed me to do so in case I did have some pain through the night. But honestly, the pain level was very, very low. I was able to reach the office at any time if I had any concerns or questions about the post-op, or any kind of concern that I had. I've definitely gained inner strength as well as outer strength, so I feel much more confident in my body image. All my friends, my family members, they can see that I'm looking better, feeling more self-confident. I've had a lot of internal growth. I've referred about 6 other patients here. Would I do it again? Absolutely. In a heartbeat, no question.